Welcome back. Today's medical moment may hit close to home for a lot of folks. We're shedding light on the topic of caregiving, especially when it comes to cancer. Joining us now is Jackie Tennant, Director of the Cancer Care at Government Healthcare. So good to see you, Jackie.
Good to see you.
Now, I understand that you have a personal experience that you can share with us in this regard, if you could please do so.
Yeah, I do. My husband, who is 55 years old, last November 2016, woke up with leg pain, and it was quite severe, and it ended up in a hospitalization. And while we were in the hospital, we received the diagnosis that he had cancer. And like it is for most people, it was a breathtaking moment, unexpected, and we were really quite shocked as to how advanced it was. It had spread from his esophagus to the lymph nodes in his stomach, and he had 9 tumors in his liver.
Oh my goodness.
Yeah.
So he had no idea that this was happening?
He did not. He had no symptoms. The only symptom he really had was this severe leg pain, and it was significant enough that he did, require hospitalization.
That must have been very difficult for you folks.
Yeah, it was. But if a couple bits of advice I would give folks is, when you receive a diagnosis of cancer, you're not expecting it, and when you hear the stages of cancer, cancer alone by itself is a very scary diagnosis. But then when doctors start putting a stage to it, and it goes from 1 to 4, and 4 of course is more serious. But I think the most important thing that you can do, what we did, was not get locked into those numbers. It is important to understand where your cancer is, how far has it advanced. But doctors use that information to provide care. They provide standards of care, and it helps to direct your care. So when we received that information, took a breath, take a couple deep breaths, but we didn't want to get locked into it. As far as prognosis, we understood it was serious. All cancer is serious, but we really wanted to know what our options were, and for us to stay focused on the positive. And we had a trusting relationship with our doctor, his doctor, and I think more than anything, cancer, as ugly as it is been a very beautiful journey for us, because of people who have come to our side, our family and friends. It's been with a lot of love and care and prayer and faith.
And that's something that folks at Covenant, I would imagine, should be able to provide.
Yes.
Thank you so much for sharing that experience with us today, Jackie. Now, if you want more information about finding a physician or resources for cancer patients, we've posted a couple of links on the TV5 Hot Links page. Be sure to tune in to the News at 9 every Wednesday for your medical moment.